The Federal Executive Council (FEC) has given the green light for the creation of Medipool, a national group purchasing organization aimed at reducing the cost of critical medicines and healthcare supplies across Nigeria. Press reports that this move, according to Coordinating Minister of Health and Social Welfare Muhammad Ali Pate, is designed to make quality medicines more accessible to Nigerians while also supporting local pharmaceutical manufacturing. And now, our focus shall be on cost of Medicare in Nigeria, and we'll be having this conversation with a public health consultant, Dr. CHIKEZIE OBASI. Doc, thanks for having me in our studios this evening.
Good evening.
Good evening, Doc.
Good evening, Maggie.
As the cost of living skyrockets, the prices of health services, essential medications, medications, laboratory tests, and all healthcare matters encompassing, they've all surged and making access to adequate and effective treatment a luxury for many. I'll tell you the truth, Doc. Many Nigerians have somehow turned to social media for prescriptions and possible treatment. And so this new development is announced by the federal government. Let's start from there.
I must, first of all, let me thank the minister. Let me thank the Federal Executive Council for, at least making a move, to see if Nigerians could have affordable, quality medication across the federation. The announcement for me theoretically it is a welcome development, but we know clearly that practically it might be almost a difficult task to perform, because beyond the cost of medication, there are other issues that surround people accessing quality healthcare in Nigeria. The purchasing drug in pools, like they are trying to make, actually will reduce the cost of drugs, or as the consumers will pay. It will enhance quality medication. It will make drug monitoring become a lot easier. It will reduce logistics, and actually to have a backward integration, in the sense that most of the drugs you need, like let me give an example, paracetamol, most likely will be sourced locally. With Nigerian first policy, the Nigerian first policy, Nigeria is actually trying to operate now. It might give room to the local producers to produce their medication, and that means that for those of the drugs we prioritize buying locally, we'll be rest assured we'll have quality drugs. I must tell you that's a commendable, laudable program. I said it theoretically it is good. The big question is what are other factors that actually made Nigerians not to have quality drugs across the federation.
I think you will have to also address that.
Yes, we begin to look at how is our health system run. Our health system is run via three mechanisms, 3 layers. You have, or 4 layers, let me say even 4. And you have the private, people in private sector. And then you have the local government system, which is government, and you have the state government, and then the federal government. If you look at it critically, you see that the 80% of the healthcare services are to be rendered via the local government system. That the primary healthcare system. And then the remaining 20% will be shared between the federal institutions and then the state institutions. While the federal institutions take care of, teaching hospitals, federal medical centers, and specialty ends, the state has a bulk of general hospitals and specialized hospitals. And so many states these days have gotten up to tertiary institutions. We know in Enugu State we have 2, or even more than that, because we have where we train even nurses and so many other places. However, now if you take a look at it, you begin to see that Ali Patehimi, the Minister for the Minister of Health, is addressing the bulk purchases. We work through National Health Insurance scheme, that National Health Insurance Authority, and then work through the tertiary institution using public-private bulk purchasing. Now let's look at the mechanism he's looking at. The mechanism, first of all, National Health Insurance Authority has registered less than 30% of Nigerians into the pool. In fact, I don't even know if we have up to 15% of Nigerians in the pool. So bulkly, you see that it is civil servants at the federal government level that are still patronizing it, and then probably companies, corporate bodies that are patronizing it. Are these people the people we have as problems, the health sector? Yes, we have them partially, but we have those that are vulnerable, the poor, the poor, and those living under $1 per day. Those are people that give us all the indices, indicators of mortality, indicators, bad health indicators on the child, under 5 mortality, maternal mortality, and so on. Where are these people residing? Majority of them are residing in impoverished areas, suburban. If you see them in slum environments, these people are not insured. These people are spending their life wire in terms of health. They take a whole lot of risk. Their environment is not social determinants of health are quite poor. That's a group of them that are in town. Those of them that are in the rural areas, they do not have access to these primary health care systems, and that's where the big problem is.
Even with the health center sprawled out.
It's not a health center. Where are the health workers? Oh. That's a big problem. Now you see them patronize chemists within the environment. You see them patronize private sector. That's why I say that when they are ill and they need to pay, so they need to pay using 100% out of pocket. First, they are not under health insurance. Majority of them. Second, they do not have the money because of poverty. Thirdly, when they become ill, they undergo what we call out-of-pocket expenditure, making it very difficult for them to pay. So if you take a look at the whole thing, so the pool our minister is actually advocating for is meant for who? Exactly, again, the elites. Those that majority of them residing in town, majority of them residing within the health insurance pool. And that's number one. Number two, is it not going to begin to create a monopoly in the system? Because we have seen Nigerians abuse the process. Every process. Remember when we were doing importation, you have the big 8 importing oil and they give us anything. Are we going to be having things like that? A few Nigerians will say they want to, to go purchasing drugs because they're out of, within the pools because the law have mandated them. Are we going to have things like the way we do bulk purchases and vaccines? We saw that happen effectively and efficiently under Gavi, as much as we have a lot of inefficiency during COVID-19. But it was a little bit done better off when there's bulk purchases. Gavi came in and then got the drugs, vaccines. But those vaccines were given, freely to Nigerians. So the big question I'm having here is the pitfall. Are we going to have a lot of people that will tell us one day that they've supplemented, augmented, the purchasing of drugs, and Nigeria needs to have Nigeria needs to pay some people to waive the excess costs of the drugs we are buying, And then these are the questions that I begin to look at, because I look at if we are running a private or quasi-private socialist health system, why don't you strengthen the determinants of health and then keep the health workers, in place? For example, Kwara State government the other day said they wanted 200 doctors, in their employ, but they cannot get beyond 99, because doctors are not there. You've seen most of our nurses, once you finish training, then they are out. So the big question is, how are you going to make this process to work where there are no health workers, where you have these challenges? And then secondly, Nigerians, because the easiest way to have handled this is having Nigerians to go into health insurance pool. Now, if you have
like NHIA.
Yes, NHIA. If you have about 70% of Nigerians into health insurance pool, then you streamline the drugs they are actually consuming. And then because we have what we call generic medications, which is easier to handle. For example, many of us will have paracetamol. Every other drug, even if you call it Tuchemol, Danamol, Uomol, anything, it's a generic medication. So you can actually begin to say, let's channel all our drugs to go generic. It becomes a lot easier. Bear in mind that you have a coverage of about 17% of Nigerians who are in the system. Now, even if you are in your own private sector, you now go to that Medipool, to buy. That's number one. So, but where the market is open for everybody to purchase, it is competitive actually, but I do not know how this is going to work. Number one. Number two, we look at Nigerians who are paying for these services. Do they have what it takes to pay? Do they even have the minimum amount of money to even get into health insurance? We are still working and slugging, having some policies on ourselves. And then thirdly, you begin to see, are we not going to have corruption at the federal level? How is the state going to come into this? How is local government area going to come into this? We look at how he's trying to unveil it, but I have a pretty difficult, assessing it. And when I saw him mention countries like Kenya, countries like Singapore, that are utilizing that, I say it's United Arab Emirates. I say I hope my minister understand clearly that we're having a country of about 230 million, and then with diverse economic mechanism, diverse, with more than 40 to 50% of Nigerians, are below poverty line. When you mention United Arab Emirates, this is a country that is highly streamlined. Singapore has a lower population. Kenya is how many? So it's a lot easier, in paper to say this is going to hamper. But I mean, when it comes to practical realities, I wish, they look into it. More importantly, carry along both private sector, both local government system, and then addressing other social determinants of health, rather than just the cost of drugs.
So would you say there are significant disparities between the drugs that are being sold in the suburban areas, comparing it to the rural areas? Rather, from the rural areas comparing to the urban areas, in terms of cost and quality as well? Of course.
Let me give you a typical example. There are so many medications you may not even be able to source out if you are staying in. Let me use the typical example of. It's not possible. Why? What is the manpower to, utilizing those medications? And who are you selling the drugs to? There are some medications, antibiotics, you might be buying an ampoule about 24,000 naira per day. And then you are managing the patient in a rural setting. The person finds it difficult to even buy drug, you came to the hospital quite late, and then you needed to manage this patient. And the patient did not go to hospital early because he didn't have enough money, And then how do you buy those drugs? What you feel in those areas are cheap, low quality medications, and then that is because Nigerians do not have enough money, making the buyers, to buy poor quality medications. It's so funny that you get to some of our pharmacies, they will tell you, you see this paracetamol is sold for 500 naira a card. But look at this one, it's sold for 150. You say, but both of them are paracetamol. So I trust this one, I don't trust this one. The same seller is telling you because they know clearly that the cost of the prices of these drugs is quite out of the reach of the ordinary citizens. And if we know that a lot of our people are poor, you find that they are bound to go for the cheaper drugs. So there's a significant disparity between the drugs you purchase in developed, or not developed, but in urban centers compared to rural centers.
So how will the Nigerian government actually go about the subsidizing of medical care in Nigeria?
I refrain from the word subsidizing. I want to look at it critically before we get into what we had in fuel subsidy. Yeah, it's something that we haven't. Today we'll be talking about electricity subsidy, but I think what will Nigerian government do, to enhance, the drug? First, the most important thing to do is to improve on social determinants of poverty, and then inequality is quite high. You cannot tell a person who has less than 20 or 30,000 naira in the rural area per month to undergo CS cost about as much as 200,000-300,000 naira. It becomes extremely difficult. So that's number one. Number two, we should be able to leverage on the social health insurance scheme we're having. Bearing in mind there are people that you must at a reduced cost, using what we call vertical equity, horizontal equity. In Igbo language, they say I mean, the person that actually has more money pays more. Find a way of making people to pay a percentage of their, of whatever their earnings that comes into the health insurance pool, so that you can leverage that to, to utilize it on people that cannot pay or cannot afford. That is the whole essence of health insurance pool. So Nigerian government first needed to make sure that now every Nigerian gets into health insurance. For me, I believe that that is completely possible if you say, or to a reasonable extent, if you say that now we are having a mandatory health insurance policy. Now, once you recharge your phone, a percentage of that amount of money goes to your health insurance. So if, for example, I'm a heavy caller and I spend, let's say, 100,000 naira per month on my recharge, both recharge and data, and they say 10% of that money goes on health insurance, I already paid 10,000. Now, in the market, the woman in the rural area who cannot recharge even beyond 500 naira can only pay 50 naira. But at the same time, she gets the treatment I am getting in town. I am less prone to illness because I am living in a neater environment and probably I understand the risks I could avoid, unlike that woman in the rural area. So when I pay, it is leveraged, to treat the other woman in the rural area. So that's number one. And so I think if you're able to utilize, I just use our recharge cards as something that averagely every Nigerian today we use it. Yes. So it's easier to bring a lot of Nigerians into health insurance scheme using that pool, and then bringing social health insurance into it. It actually helps you out. That's number one. Number two, there are other things that determine healthcare. For example, bad road is one of the determinants of healthcare, which actually impedes on the cost of managing healthcare. If the road is bad, accidents are bound to occur. When accidents occur, you have people that are in the hospital, some dead, and some may be alive, having life debilitating illnesses. If a person has a spinal cord injury, that becomes an issue. Even the cost of running it, even the drugs and so on. Remember, when we talk about drugs, it's not just only drugs. Other things that happen to use in managing people are still there. Managing sick patients are involved. So you find that if when you improve on poverty, you bridge inequality, you have a lot of infrastructure come on board. I mean, you reduce the cost drastically. So it's not just buying the drugs. For example, I will tell you, the pharmaceutical industries in Nigeria are not suffering because government is having, they don't have good brains to work. But the big question is, assuming if we want to, you want about 30 million naira to go on pharmaceutical, to go producing a drug, I'm using that as an example, does the bank give you a moratorium? It becomes difficult. At what interest rate? 35% interest rate. Which manufacturer goes into it? So these are areas the government should be able to look into to see. For a while, medical and the Nigerian Medical Association have been asking government go into what we call health bank, and so that people who are in the health industry can actually access health loans specifically for healthcare services and healthcare delivery at a single digit interest rate. Just like we have Bank of Agriculture, we're equally asking that to go on education, so that students and lecturers, people running educational things that should be accessible to everybody, should go on very low interest rates, so that you allow that industry to grow. And then finally, I must tell you, retaining our health workers is one very big problem. Some illnesses, like I said earlier, 80% of the diseases we suffer should have ended at primary healthcare centers. Why are they not ending there? Simply because you find out that health workers are not available in our rural settings. I don't know your community, but I can tell you, if you walk into your community now, this evening, you might find it difficult to see a medical doctor at his duty post, if at all there's one in the health post that was posted to that environment. You might find it very difficult to see a nurse at that place. So how do you want to take care of those people? It becomes difficult. If there's an emergency that occurs this night, that emergency will wait till morning. I mean, if it's something that would have been averted, the person might have gone so bad by the next morning, which even if there is a doctor in the rural setting, will tell you, okay, move to the higher hospital because you can't manage it. This would have been an issue that would have been averted, if it was presented early enough. So these are a few things I feel government should be able to look in that will affect whatever they are doing. And then finally, we talk about corruption. the system is, is bedeviled with a lot of corruption. NAFDAC, as it were today, we saw when they went around the federation confiscating medications. You see people having NAFDAC numbers on their drugs. You scratch the numbers, you go another, they say it's genuine, and you hitting this patient with medication, it will fly. Some of them, you see the batch numbers, the SMS numbers actually go for other things other than even medications. So monitoring of our drug, and then even looking at counterfeit drugs and so on is a problem. The system is so terrible. People import whatever they want to import into the country, and they are certified by relevant authorities. Many of the drugs that we are carted away by NAFDAC in the last exercise, that went on some few months ago, we had NAFDAC numbers. So how did they get the batch numbers? So these are big questions you will be tackling.
Okay, we have witnessed pharmaceutical giants leave the country, and of course we'll have to make do with alternatives to whatever medication they were manufacturing, whatever drugs they were manufacturing. But then you still see, probably because of the potency of what they had, doctors prescribing some of these drugs, and consequently we are getting it at a very exorbitant price. I don't want to say the government is to be blamed. I don't want us to go that angle, but tell us, what should have been a better option?
Pharmaceutical companies leaving the country has a whole lot of reasons. You see, more recently, countries are building what we call gigafactories. Gigafactories are, factories that could, run on economy of scale. Many of them will run on robotics. The running cost becomes a lot cheaper. And then they weigh in on logistic management, transport, trying to supply the finished products, number one. Then number two, you and I know clearly that we run companies where you have easy access to raw materials. Today, as I speak to you, Nigeria has a very big problem when it comes to stability of the currency. Our fiscal policies have not been having it good. Over the last few years, we saw Naira depreciate from a whopping 450 Naira to $1 in the last 2 years to something as bad as 1,600 Naira per $1. That does not really promote, and tell any company to remain around. It becomes difficult for the company to maintain. We can't boast of stable electricity. It's a terrible situation. So when a company looks at it like GSK and so on, and they look at countries like India that has stable electricity, has a petrochemical industry that will give them a lot of things they needed to work with, has nearness to raw material is quite available. Why wouldn't they go there? And then they think of giving you running a logistic approach to you, sending their drugs to you, that becomes better for them, cheaper than running your country. So I think the first thing our government needed to do is to what I call prioritizing our companies. Have a big problem, and I say it's a holistic issue, not just thinking of establishing a company. Let me give you a typical example. Petrochemical industry has a lot to do in manufacturing of drugs. In fact, they will tell you about 90% to 99% of the recipients they need in manufacturing drugs actually come from petrochemical industries, benzene, toluene, and so on. Do we have that in here? We only just have Dangote refineries that came up the other day, and it has not actually stabilized in producing those petrochemical products. The companies, would utilize. And even if you have those companies there, like I said, one of the greatest problem you have today is electricity. Many of these companies, abroad run on 24/7 electricity. Some of them run on robotics. So, and they need stable electricity supply. They need good logistic management. They need nearest of raw material. Do we have them here? It's difficult. So, what would our government do? For me, my angle is I'm not just coming from medical point of view. I'm a public health physician, so I understand that there are other factors beyond just health industry in making these things work. You can't tell a pharmacist in Nigeria to stay behind the country without feeding his family. So he's going to run the pharmaceutical industry. It becomes a difficult one. So who man our logistic chain when it comes to pharmaceutical products? These are people that most of them are traders who do not know anything about running logistic chain supply of for drugs. If you go to Obete, go to so many businesses, you see them telling you that they have vaccines. Vaccine come in cold chain, and then you ask them, how do you preserve the vaccine? They'll tell you they keep it in the fridge. You come, you try to access the fridge. The fridge only comes on in the morning. By the time they close their market, the fridge goes off. Take a look at the viability of those vaccines. They're not there. But we consume them. It's unfortunate, and that is how so many drugs are. Now, I believe that.
And these drugs are not fake, but poorly preserved.
When you have a poorly preserved medication, that it should be preserved within a temperature range or within an environment, just like your studio here. If you do not have AC here for a short while, you might begin to see your system malfunction. That's how it is. So most of these drugs have conditions attached to their their preservation, and that's where some of us will always ask, can we have a drug market? You mark out acres of land and then build drug markets so that people come in there in that drug market to have complements. The NAFDAC will be there. Analysis can easily be done in such drug market, and people can understand that if I walk into this drug market, any medication I'm going out with from that drug market comes out from a storeroom or with optimal conditions. And then again, there is this narrowness to getting of looking at the drugs you have there, and then making sure that those drugs are working efficiently. This can be done within the state, but again, remember that you must have the supply chain services to work efficiently. So it's not just one approach of handling the medical aspect or the pharmaceutical aspect that will work. There are other things that are interconnected.
Okay. I know you have talked about some of these indices, but let's actually conclude by looking at the supposed issues that may come with this latest development with the federal government stance right now, this latest development. Are we expecting challenges?
Yes, of course. Those are the various things I said. At first, I need to see the state government, the local government system, the private sector
key into
it. I need to see us coming up with our, having our health insurance pool, coming up to about 70% of Nigerians being into health insurance system, so that we can have a proper logistic management. Because once the patients come into that pool, drugs you must use are determined to a reasonable extent. And then I need to see Nigerians who can walk into health facility and then assess out, not because they do not have money or because they have money. They should have access to health because health is a human right. It's at that level that you could see Nigerians begin to ask for the best. There are companies that
asking for the best. Does it translate to getting the best?
Yes, if you ask for the best, it simply means you are
aware.
You are aware, first of all, and you have paid your own price. For example, you walk into a banking hall, walk into a supermarket, you're buying things, and then if they give you any fake product, you can actually react because that's your money. Now, if Nigerians are into health insurance pool and they pay, no matter the stipend they're paying, they can actually demand for a better service. And then when that pool, let me give you a typical example. A doctor who runs his hospital with 5 million naira, for example, within a month, can actually understand clearly that if he does, let's say, if you are having, let's say, a gynecological hospital, and you run, you do 10 CS only in a month, and you decide to say that 5 million naira on 10 CS, it translates to 500,000 naira per individual. That's the cost I will have, I will make in a month, the amount I will make in a month to enable me pay my salaries, clear my debt, do their running, both fixed and the current expenditure, and then have some profit. But let's assume this man now knows that in a month he can actually do 100 CS. You can see the difference here now. So with 100 CS, this same man can do that same operation of 500,000 with 70,000 naira. 100 multiplied by 70,000 will give him 7 million naira. He has 2 million naira again. He can afford to employ another doctor. You see what the cost will be. So that is what the pool should be. When people are in that health insurance pool, more people will access the services better off. More people will come to the hospital. Hospital will have more money and make this bulk purchases he's talking about. And it becomes easier because if you get to a hospital and it didn't give you the services you need, you pool. So the doctors and the health workers will access the best of quality drugs. And you see competition coming in, you know. But if you don't create that market for the competition to come in, it becomes a difficult one. So that market is needed to be created by having a volume of people getting into our pools and then having the money, or you know, tapping from the riches of that people that will be there, and then create the market for it to work.
Thank you very much, Dr. CHIKEZIE OBASI, for your robust contribution on the subject matter this evening.
Thank you very much.
Save Nature TV. News in your pocket.